But where's Louisville?
That's
Because
small cities, yeah.
what school's in Loretto, Pennsylvania?
LaSalle, maybe?
No, that's in Philly.
Yeah, Philly's 9, and then Fayette,
Loretta,
Mississippi.
I don't know where Loretta, Pennsylvania is.
Because Penn State is
State College.
college, yeah.
You guys just have
Oh, and the-
troll news all day long, don't you?
Yeah.
The worst, number 289, Pocatello, Idaho.
My God.
Well,
Get those dated if you keep trolling all that stuff.
When I had those pictures for Getty go viral, my wife said, if you don't shut your Twitter off, I'm throwing your phone out the window.
Were they the ones that took on Penny and Austin? Oh, yeah.
Nope.
And you nailed it.
Wives have the right to dictate. Do you all know what's fake and what's real? I mean, can you all determine?
So what you have to do is more than reading stories, you have to find journalists that you trust and follow them. So I think Bruce Springsteen is 100% factual, right? And that sounds like I'm kissing up, but I mean, it's the fact. I know Bruce and I know how hard he works. And I have people, state, local, and national level that I trust. If I read it on Facebook, I got it.
Yeah, I know.
You know, those Facebook people are stupid, and I swear that, and I don't mean everybody on Facebook is stupid. I don't mean that they're stupid in life. But the minute they engage with Facebook, their IQ is diminished.
And they're totally ignorant of what's up. And we get calls from individuals about Facebook posts all the time. How do you tell them?
You gotta find people you trust.
I mean, yes. Just trying to find that story out there.
No, it's hard to yellow. Yeah. I figure if he's on those things, somebody's here by 8:30, probably the best idea is try to click on it. You should still see. It's nice to be in the middle when you have an hour. I mean,
Yeah, I mean, I can zoom in and it's like away from it.
You're the free TSA.
I have one, but it's just.
And positively identified in California. Yeah. Now they're trying to determine how many people they came in contact with.
In LA or something?
They said it's in California. Yeah, it's got to be somewhere.
Taking notes, want to pick a picture.
TSA, I can't believe that.
I mean, I don't really use these for collecting video anymore. I just need, I have this little handheld gimbal thing. It's like, looks like a head sensor. And it's basically
Just
just
sort of
a
concerned for the families.
gimbal.
15 a.m. Update on the coronavirus in Kentucky. Like each day, we will go through the number of cases in Kentucky. We will go through the steps we have taken, and we're going to announce some new steps today, like we've announced just about every other day. We announced yesterday afternoon that currently in Kentucky we have 8 positive cases. 5 are in Harrison County, 2 are in Fayette County, 1 is in Jefferson County. The way those break down is we have 4 in isolation in a hospital. We have 4 in isolation at home. The good news is that all 8, to our knowledge, are stable, are doing well, and a couple of these individuals may almost be through this. And that is very, very good news. To date, we have had 54 tests, 46 have been negative, and 8 have been positive. But we here in the state are very intentionally being aggressive in how we address the coronavirus. That is both to try to prevent cases, to prevent a spike in cases, which we have seen in other areas, and to get more time as the different labs and other possibilities come online. It's important that everybody out there remain calm. We are going to get through this. Yes, there will be some disruptions in our daily lives, and we've already instituted steps that are disruptions. These will be annoyances, I get that, but it's incredibly important that we take these steps, that we practice good hygiene, and that we protect one another. And we have to get through this with compassion, making sure that our homebound seniors are still taken care of, making sure that we still provide the essential services to our people. And after someone has tested positive and has gone through the self-isolation period, has had those 2 negative tests, and thankfully is able to step out of that isolation, we need to treat them like everybody else in this state. As a recap, steps we have taken here in the Commonwealth include the state of emergency, which I called, which gives us all the tools under state law to address the spread of the coronavirus. We have activated the State Health Operations Center and the Emergency Management Operations Center. We have just held a call yesterday with all 120 county judges and their emergency management folks to discuss the emergency managed network, to give them an update on this, and to talk with them and answer any questions. We've initiated changes to Medicaid, including eliminating prior authorization and any type of fees associated with testing or treatment on the coronavirus. I filed an executive order to waive copays and other costs related to private insurers that we have that type of power and control over. I issued an executive order to prohibit price gouging, and I've asked Attorney General Daniel Cameron to enforce the price gouging laws. If anyone has information regarding possible price gouging, they should contact the Office of the Attorney General Consumer Protection Hotline at 888-432-9257. We have issued guidance on our website. This is the source in Kentucky for reliable information. There's a reason we have this website and not a lot of other social media or other points. We need to drive everyone to this one resource. It's kycovid19.ky.gov, kycovid19.ky.gov. It provides an update on tests, positive cases, and it provides updates on the guidance that we have provided and that the CDC has provided. We have our coronavirus hotline up and running, 1-800-722-5725, 1-800-722-5725. We've put out guidance and an infographic on when to seek care. That means if you are well but nervous, call the hotline. Don't flood our health systems. It means that if you are sick but otherwise would not have sought medical attention, but for the coronavirus, again, make a call. Don't flood that healthcare system. But if you are truly sick and would have sought attention otherwise, if you have an injury where you need medical attention, please go get it. We've published the CDC guidelines with their warnings, and it's important that we repeat them every time that we do this. Individuals over 60, do not go places where there are large crowds. We need you to alter the times that you would do your grocery shopping or other interactions with those large crowds. It's very important guidance. And individuals that appear vulnerable to this coronavirus, which right now we believe are folks that have heart, lung, or kidney disease or a compromised immune system, again, follow that same advice. Do not go places that there are large crowds. And for these vulnerable populations and those over 60, do not fly. Please do not get on a cruise ship for any reason whatsoever. That's the same guidance that the leading expert in the United States is giving every single time that he is interviewed. We provided strong guidance advising nursing homes and long-term care facilities to restrict visitors except in end-of-life situations. And we in state-run facilities are restricting visitation. We know that this is going to be difficult, that we want to be able to check on our loved ones and we want to make sure they're getting the care that they need. We are stepping up our inspections from our Office of Inspector General and CHFS to try to make sure that all of those needs are being met and the proper care is being given. And while it's going to be hard for many people not to see a loved one during this period of time, what could happen if this coronavirus gets into one of those facilities can be devastating, as we see in Seattle. And it's my job to protect the health and life of those individuals, especially the most vulnerable. So please, I understand this is going to be hard, but understand how important it is that we restrict that visitation. We've asked business to prepare telework options and adopt paid sick leave. We're already seeing some national employers do that. State employers, please look at that option. We believe that it is necessary. I've signed an executive order that allows pharmacists to refill prescriptions up to 30 days, and if we need to stage pharmacy areas outside of the normal pharmacy that is on the license, we'll have the ability to do that too. And we've issued guidance from our personnel cabinet regarding personnel protocols for state employees. We want in government to be a model of what we're asking others to do. So we're ensuring that everybody in state government has the sick leave that they need. In state government, you accrue your number of sick days by how long you've been working in state government, and that's a problem. Because if we have someone that is sick that hasn't accrued those days, they need to be able to have that paid leave, and we've already put out the guidance and the directive that we are providing that. So, new steps that we're providing today, and there are a number of these steps. Again, while we only have 8 cases, we know that this is community spread, and we think it's very important to get ahead of it. First, we are closing all of our state prisons and similar facilities to visitors. This is a step that other states are taking, and we believe, given the confined space, that it is necessary. I'm going to ask Judge Noble in a minute to talk about some other things we're going to do to make sure those prisoners can still contact their loved ones, which means, I believe, some additional free calls and other opportunities. We know that it's going to be hard, again, on families and on prisoners where that visit is so important. But this is about protecting their health, the health of our corrections officers, and making sure that we get through this. We will be talking to our jailers today on a call here in a little bit. We're going to be providing them similar guidance. We're asking our schools and school systems, and we will have a call with our superintendents later, to develop plans to be able to close on short notice if necessary. That could be as short as 72 hours. And while we are not there yet, it is very possible that in the future we're going to have to ask schools in Kentucky to close down for a period of time. We want to be prepared. We want to make sure that if we do that, kids still get the meals that they desperately need and the care that they need. While this coronavirus does not appear to affect children, and that is really good news if you're the dad of a 9 and a 10-year-old. The number of people that our kids can interact with means we've got to be very thoughtful about what we do as far as the school system. We're giving everybody some more aggressive guidance today on crowds. we are recommending that every individual in Kentucky do what they can to minimize their interaction and going to large meetings or groups. That includes community services. So I'll announce today that we are going to cancel the prayer breakfast that we were going to have this week. Faith is very important to me. This prayer breakfast is very important to me. But the life and health of our people is just as important to me. I don't believe that whether you go to church during this period of time is a test of faith. I believe God gives us wisdom to protect each other, and we should do that. And I'm going to recommend that our churches across Kentucky cancel their services for this weekend. Again, I know that that's a big step. I know that some won't agree with it. But I believe that it's our job to offer those protections, that we have a lot of opportunity for virtual services. I know those out there that would otherwise go have an opportunity to get out that Bible or whatever it is of their faith that gives them guidance, and ensure that they have that time with their family this weekend, where in their own home they can practice their faith and worship. We are going to suspend non-essential travel for state employees, and we are going to recommend that businesses do the same, and that is any out-of-state travel. We're going to go ahead and recommend that employers institute telework where they can. This is getting ahead. It's trying to prevent the spread and ensure that the entire healthcare system has the time to be fully ready. I believe that we are ready, but we want to make sure that we can service everyone ultimately that needs our help. And we'll be providing guidance for steps that we are taking in the Capitol a little later today. As you can see, the chairs are a little more spread out here, and we're going to be taking steps like that as we move forward. So I know that is a number of new steps, and we're going to hear new steps every single day. I'd remind people that we learn something new about this virus just about every day, and so we're going to have to be fluid and flexible in how we adjust. But once again, we're going to be okay. We're going to make it through this. I'm going to try to continue to lead with information, to provide updates once or even multiple times a day. I can tell you that despite an SEC tournament this weekend, I'm going to be right here, because that's where I need to be, making sure that we are continuing to provide the updates and the guidance that we need. We will get through this, Kentucky. To all of our families, we will get through this. It's okay to be nervous and to be prepared, but do not panic. Stay calm. We're going to make it. For those that have concerns about not being able to find hand sanitizer, remember, soap and water is better. Wash your hands multiple times a day, every day. Clean surfaces throughout your house and your place of business. If you're having trouble finding commercial cleaners, a 1-100 bleach solution we believe is very effective. Make sure that if you are sick, do not go to work. There are two things in this that we should all want, being good neighbors to each other. Number one is that we want to protect ourselves and our families. But number two is we should not want to spread this to anybody else, because so many people are asymptomatic who have it. And remember that if your kid is sick, they need to stay home from school as well. That while right now it doesn't appear to impact children, and we'll learn more about that, or in the same way that it does other adults, that doesn't mean that your child couldn't go to school, it be spread, and ultimately someone else be infected with it. So all of these are aggressive steps, but we believe that they are necessary steps that will help us to ultimately move through this. Now, I'm going to first ask that Secretary Noble come up and talk a little bit about our closure to visitation of our state prison and other similar institutions. Secretary Noble.
Yes, sir. Thank you, Governor.
Thank you.
Good morning, everyone. Some of you may have noticed that I moved 2 steps away from Secretary Friedlander. That's because I realized I was not maintaining proper social distance. This is an important thing for us to be aware of, and to that end, every step that the governor has taken And consequently, every step that his cabinet secretaries are taking is because we care deeply about the health and welfare of the citizens of Kentucky. And some of those citizens are confined in our institutions. Because they are confined, they are our responsibility. And we are trying very hard. I don't think anybody can ensure about this virus, but to do our best to maintain their health in that closed environment. To that end, we did decide that it was the best thing to do to stop outside visitation. And that's a very hard decision to make, because for a confined person, seeing your family and friends on that weekly visit is very important. But here's another important fact. Our confined people love their families and friends, and they don't want them exposed to the virus either. So we are working together with the folks in our institutions to temporarily suspend this visitation. We don't know how long, but not a day longer than we have to. To assist in this process, we are going to provide them with a free phone call each week and up to 2, I believe, contacts through a controlled social media source. It's not the same as seeing them in the flesh, we know that, but it is a good option, we believe, at this time to keep contact with friends and family. We're all working together, and I'm really appreciative of the help that we are getting from those that are confined themselves.
Next, we'll hear from our Public Health Commissioner, and I know I say this each and every day, but he is doing an amazing job, and his people are working harder than I think any of us could have ever imagined to address this. I know that while I haven't slept a lot in the past 4 or 5 days, that they have been truly heroes in what they are doing, as have our local health departments. Let me reiterate how proud I am of the steps Harrison County has taken, how they have all come together, the good decisions that they made, the importance of WEDCO, which is their local health department serving a number of counties, their local newspaper, which put together 18,000 extras to put in people's mailbox. You know, that county is going through a tough time, but their leadership has been steady. They have reached out to every individual in their community. They're going to be the model, I believe, of how we communicate and address this when you have a number of positive tests in one county. So now, Dr. Stephen Stack.
Thank you. Thank you, Governor. And I would like to thank the Governor. His leadership and his support has made this response so much better than it could have otherwise been. These steps we recommend are not made lightly, and they're made in a time what I'm accustomed to in the emergency department, where information is not what we want it to be, but you have to be quick and aggressive in making the decisions you think are the best possible ones to get ahead of the present situation. And so I'm very grateful to the Governor and to his entire larger team for responding so constructively to those. I would like to draw attention, every time you've seen us, and we've brought a lot of people up on stage. I was on a live broadcast show last night. I hope the community of Kentucky observes how people are coming together and how everyone is working together to address this. We all recognize the uncertainty. We all know people are concerned. We're all messaging calm and the need to have confidence in the efforts we're taking, because we believe that the team together will find a way to mitigate this or reduce the impact of this as much as we possibly can. Reducing the impact doesn't mean eliminating the impact, however, and the best chance to reduce it to the maximum amount is to enlist all of your help and support. So as we continue to release new guidance, I urge and ask you to go to our website on a daily basis. The website's probably being broadcast, but it's kycovid19.ky.gov. I really urge you to go there and look. There will be daily updates. There will be updates specific to your particular community or population, often added daily or multiple times a day. Please go there. Please express your appreciation and gratitude to those you know are working in the response efforts. And please, we keep telling you these things, but we tell you because they work. Please do things like washing your hands for 20 seconds at least with soap and water, using hand sanitizer when you don't have those things, covering your cough or a sneeze with a tissue, staying home if you're sick, and keeping your kids home if they're sick. And as we make recommendations for more substantial distancing activities, such as the governor mentioned earlier, please know they're not made lightly. Please work with us to make them effective. If we do these things, we're hopeful that the current evidence around the country and around the world shows they can have a positive impact. And if we do them promptly, we have the best chance of reducing the impact of the disease. So thank you for all of your assistance as we respond to this.
And before we open it up to questions, like Dr. Stack, I do want to thank the media for making sure that in just about each and every story we get out the practices that people can take to mitigate both their chances for getting the coronavirus and for spreading it. That's that good hygiene. And I just remind everybody that it's really important that we're mindful of what a tweet can look like without being in context, and that facts and context really matter to make sure that we're giving people the overall picture that tells them to remain calm. We appreciate how that information has gotten out, and we think that has helped people in Kentucky to know what that they should do. So with that, we'll take questions.
Governor, there are a lot of churches that have Wednesday night services as well. You're not going to put in your recommendation until this weekend?
Oh, I would recommend that people right now start avoiding large gatherings, and that would include those services. And again, I know that there's going to be some pushback on it, and I hope, given that what this job is and how I got it, that people understand that I wouldn't recommend it if I did not believe that it was necessary. And especially when you look at our churches, we do have higher senior populations in them. Those with medical conditions, make sure they get to church oftentimes on the weekends. I know as I look around my church, I want to make sure that we protect so many of the folks that go.
Frequent hand washing requires use of public facilities and public buildings, which tend not to have hot water right away when you turn the faucet. How important is hot or warm water in washing hands, or is cold water good enough?
I'm going to let the medical professional answer that one.
Soap and water, regardless of the temperature, will be sufficient for this purpose. So the other thing I'm just going to mention, the social distancing item of staying about 6 feet away from each other, we're not recommending you can't go grocery shopping. We're not recommending you can't go purchase things that you need. As long as we just allow extra space between each other and we use proper hygiene, we can still go about our daily activities, and you can still support your local businesses and get the materials you need for being at home, as long as we just take these steps to have more social distancing. So just be very self-aware and encourage others to do the same thing. And those steps, while they seem really simple, are really powerful if we all do them.
Governor, we're getting some pushback already on the service cancellation. Why that recommendation when things like the basketball tournaments, the Sweet 16, are continuing?
Well, there's the recommendations that we are giving today, and obviously there will be more as we go forward. We have a whole lot of people in Kentucky that, whether it's a community event, and these are all community events and meetings that we are making the recommendation for. I just know that certainly by the time we get to Sunday, the most common thing that people in Kentucky would go to would be their church service. I will say for the SEC tournament or any others, certainly look at that CDC guideline. Anyone over 60 and anyone who is in the vulnerable population of heart, lung, or kidney disease should not go. I believe should not go. That's what the CDC is saying. Avoid those large crowds. That is the guidance of the experts that are out there.
Berea has closed classes for the rest of the semester. Other schools looking at that. What's your recommendation right now? Did Berea do the right thing? What are you recommending?
Well, I'm not going to criticize anybody's reaction to the coronavirus, given that they are operating on some of the same information that we are. We are not yet ready to recommend the type of action that Berea took, but they took aggressive action, and we're not going to criticize them whatsoever for doing that.
What about the General Assembly, these committee meetings? They get very, very crowded. All the groups
Yes.
that come in, rallies?
So we're putting out guidance later this afternoon, later today on the Capitol. You will be seeing us taking steps throughout the day, and we'll have those for you. And we are already doing extra cleanings in the Capitol. Before this, as you notice, we're spread out a little bit more than we would normally be. We're going to be communicating with leadership what some of those steps are going to be. One will be that we are going to close the cafeteria seating area, not the actual service in the cafeteria itself, but that is just a densely packed place, just like businesses are recommending that they close their cafeteria seating and that people eat at their desk. There's going to be a number of other steps, and we're going to be thoughtful about how we move forward. We ought to be modeling behavior here at the Capitol that we want other people to engage in.
Governor, I have to ask this question because a big part of your election bid and what you did on Inauguration Day was you swung open the doors to the Capitol. And you said, this is everyone's Capitol, you're allowed inside. Will today's recommendations later today close those doors
No.
and keep people out?
It won't. Now, we would highly recommend that if you are sick, you do not come into the Capitol because you shouldn't be leaving your home. But what we're going to do is try to put in recommendations that have that same type of social distancing, that take our physical setups in the various rooms that we have and try to adjust to that social distancing. Now, this is still everybody's Capitol, but as we have to make some tough decisions, everybody understand we are in a state of emergency, and that while everybody should remain calm, we want to make sure that we don't have a spike in this coronavirus. While we will see more positive cases, and everybody ought to be prepared for that, we want to mitigate the long-term impact and protect the health of our citizens.
Someone will be watching this live stream right now, and the obvious question in their mind will be, we did not have any new cases overnight. It sounds like at least a couple people.
We haven't gotten any more tests back since yesterday. So yesterday's last batch was 20 tests, 2 positives, 18 negative. We'll have the next round of results at the end of today.
So there is a chance we'll have more positive cases later today?
Oh, and I don't know that we will have tests today. And I don't want to presume how they will come out, but as we move forward, we will absolutely have more positive tests, and we have to prepare for that. There's going to be more positive tests in Kentucky.
Does the order on long-term care facilities include assisted living facilities?
Eric?
The state doesn't actually operate assisted living facilities, but the guidance applies. We would anticipate that assisted living facilities would follow the guidance for long-term care.
That's my presumption.
And if I can make one more plug for the website, all of this guidance is up there. Guidance for people who are helping loved ones or friends in self-isolation, guidance for counties that have a case, guidance for our prison and jails is going to be up here. So we got to drive people to KentuckyCovid19.gov.
Can you tell us any more about the connections between the 5 cases in Harrison County?
At this time, I think we've shared all the information we can there, though we have at least a connection between each of those 5 individuals. We're hoping that we can flesh that out more as more information becomes available to us. The epidemiologists are working on that right now.
We know that, sorry, one more follow-up. We know the 27-year-old was the first person to test positive, but that doesn't necessarily mean she was the first person to get the disease.
That's absolutely true, that we cannot determine that she was the first person, and she probably wasn't.
And do we know who that first person was and how it was spread?
At this time, we do not, and we may learn that, but we also may not. Given that this is now community spread, a large part of what we're going to be doing is mitigation as opposed to simply tracing. Knowing that it is already in the community, it's how do we keep it from spreading further in the community.
Are there any new recommendations for airports in the Commonwealth, or would that be a federal matter, or are you working with federal officials on making any recommendations for airports?
At this time, we don't have any other recommendations on airports, except that if you fall within the CDC guidelines of being over 60 or being a part of the vulnerable population, don't fly.
How many requests?
I think they suggest you don't fly. I'm saying don't fly.
How many requests for tests have been denied on the basis of CDC guidelines?
I don't think that we have that number because it is a collaborative effort between the treating clinicians and our Department for Public Health. Now,
The department doesn't keep a record of requests for tests?
well, there are people who request a test from their doctor, and their doctor says you don't fall in to any of the symptoms.
Now, my
There's,
question is, how many have been denied by the department?
I'll ask Dr. Stack.
So the question is, how many people have been denied testing for COVID-19 by the department? And I don't have that answer as I stand here, but I think that
Can we get it later today?
no, you can't. And the answer is very clear for that. We're using the test capacity that is available in the country at this time to the greatest possible impact. And the epidemiologists are busy talking to people on the phones all the time, trying to find out who needs testing and who doesn't. So there'll be time at a later point to be able to go over how many people called and how many people got the test. Right now, the team's focused on helping as many people as it possibly can. So I support my team in doing what they need to do to keep the people in Kentucky as safe as we are able. Now, I want everyone to be very clear when I say this. When we want everybody to be able to have a test who has concern. And when the commercial industry gets up to speed and provides that resource, then people will be able to get that test. The governor has taken steps to waive copays and ensure that insurance companies cover the testing. When the commercial industry makes the resource available, the resource will be made available to the people of Kentucky. The resource is not currently generally available, and therefore I have an obligation to support the team in using it to the greatest effect to keep the people in Kentucky safe.
Do you anticipate, well, let me ask this way, do you think the state has enough funding to deal with this issue, and do you anticipate needing more, and where might it come from?
So with the state of emergency, we do have the ability both to tap into a $4.5 million appropriation that is in the current year budget. We also have the ability, if our costs exceed that, to spend from the Budget Reserve Trust Fund and any surplus. I believe we will have the funding needed, but I've also been assured by legislative leadership that they are ready to help in whatever way they can.
The Girls Sweet 16 starts today, 1 o'clock. Is there any recommendation about that specifically?
If you fall within the CDC guidelines of being over 60 or being a part of the vulnerable population, having kidney, heart, or lung disease, or having a compromised immune system, don't go.
When do we expect some of these commercial sites to come open, and how many are we talking about?
Well, we're getting different information on that every day. There are 2 national labs that we believe are up and running, but that doesn't mean that they have their capacity up and online. Oftentimes we are told weeks or within a week, but then we hear contradictory information. Our hope is that it happens as soon as possible, but we don't want to give people information suggesting it's going to be here before it is. That makes these mitigation steps that we are taking so incredibly important. And once there is widespread testing, we're going to learn a lot about how it spreads, and we're going to, at that point, I am sure that we are going to have different steps that we will take. Maybe we will be able to suspend steps that we're taking. But given the information that we have and the resources we have right now, what we're calling mitigation, taking those steps to prevent the spread of the virus is the most important thing that we can do.
I want to make sure that we're clear on the state's public universities, school, and colleges. Right now, you're not necessarily recommending that they suspend classes.
That's right. As of today, we are not. I know that they have had conversations about steps that they may take. We are communicating with them on that. We've been providing new guidance every day. I'm sure we'll have new steps tomorrow and the day after that as well. But as we're sitting here today, we are not making that recommendation as we are standing here today.
As a practical matter, if you have a lecture hall or you're going to have some event, would it be advisable to tell people to put a seat between each other?
Absolutely. Spread out. And we're going to be working on that here in the Capitol. So if classes are going to go forward and there is certainly space, spread out. If you can move something to a larger hall that's a smaller class, spread out. If you got a couple seats between you, you're going to be at the 6 feet distance. That's helpful. If you can do a class via Telezoom, is that or any other options, do it. I would say go ahead and do it. I know that it is not a direct substitute for the interaction, but it is important that we start engaging in the social distancing that we can. And again, it's going to be a disruption and an annoyance to our daily lives, but we are going to get through this. It's important that everybody remain calm. And I've said this before, but if we engage in a type of panic where we don't take care of our homebound seniors, where we don't act compassionately to each other, that fear will cause more damage than this virus ever could. So Kentuckians, we have been through things like this before, and we will make it through this one too. So thank you all very much.
We'll watch it.
I will.
Actually, I'm gonna listen to Charles, free.